Hi, my name is Dr. Rachel Castaneda, and I'm a professor here in the psychology department at Azusa Pacific University. We are really excited to be working with you and partner with you on our SBIRT student training initiative. Our project is an interprofessional healthcare initiative funded by SAMHSA, the Substance Abuse Mental Health Service Administration. Our project, funded by SAMHSA, is designed for undergraduate and graduate students in a wide variety of disciplines: psychology, social work, nursing, pastoral care ministry, and athletic training. As you know, there is limited training or education in the disciplines of psychology, nursing, social work, pastoral care, athletic training among students, both undergraduate and graduate, on how to identify substance use. We receive funding from SAMHSA to address this gap and embed training on how to identify substance use and address issues within the formal curriculum. Our training initiative is to embed SBIRT within the curriculum, and SBIRT has been identified as a comprehensive approach for preventing and reducing unhealthy substance use patterns. Briefly, SBIRT is an acronym, and it includes 3 evidence-based practices that help the practitioner or the provider identify substance use risk, triage the risk, and refer to treatment for further assessment. The S stands for screening, which is used to identify unhealthy risk patterns. The BI stands for the brief intervention, that is a conversation done to triage the risk using motivational-based principles of behavior change. And the RT stands for referral to treatment of high-risk users for further assessment. We are inviting you to join us in this training initiative to help better prepare our students to practice and learn about SBIRT in their internship and practicum settings. Briefly, I wanted to share with you why SBIRT is important in your clinical and community-based setting. First, we learned from nationwide surveys that millions of people report drinking or using drugs at unhealthy levels that pose risk to themselves and to the community at large. Second, under healthcare reform, SBIRT has been a national priority, recognized as a prevention priority. In California, policies have changed to the Medi-Cal beneficiary package, where now SBIRT is mandated for all providers and professionals in community and clinical settings to conduct SBIRT with Medi-Cal beneficiaries 12 years and older. Under California law, providers who are going to engage in SBIRT in clinical and community-based settings are required to engage in a one-time 4-hour training on how to conduct SBIRT. Now let's hear from practitioners and clinicians in our field. I'd like to introduce Dr. Mary Rawlings from the School of Social Work.
Hi, my name is Dr. Mary Rawlings, and I am chair of the Department of Social Work. Psychosocial assessment is a key skill for social workers. It is used across multiple practice sites with many different clients. As part of thorough assessment, it is imperative that we screen effectively for high-risk substance use so that we can maximize the behavioral and physical health of our clients. To develop these essential skills, the Council on Social Work Education, along with the National Association of Social Workers, has endorsed SBIRT as a training for social workers. Here at Azusa Pacific University, along with our other partner universities across California, we have been training our social work students in SBIRT, both BSW and MSW levels. The next step, however, is for us to help you, our agency partners, implement this at your training sites. A key element is for our students to have the opportunity to implement and practice SBIRT at their agency sites under the guidance and supervision of their field instructor. In order to help you supervise them effectively, we want to train you and your agency in SBIRT. We believe SBIRT provides a flexible and practical tool that can be implemented across service sites by both BSW and MSW students. Additionally, it's often billable in the state of California. So please partner with us. As social work is the #1 provider of behavioral health services in the country, we are in a unique position to be able to provide this intervention to people who may not otherwise have access to this care. We look forward to having you join us in this effort to implement SBIRT.
Now I'd like to introduce Drs. Linda Reed and Cheryl Tyson from the School of Nursing.
Hello, my name is Cheryl Tyson, and I'm the Associate Dean for Research at Azusa Pacific University School of Nursing. I'd like to take just a couple of moments and talk to you about why it is so important that nursing preceptors engage with us in orienting our nursing students to SBIRT. SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. It's a project or a program that the Substance Abuse and Mental Health Services Administration has implemented nationally. Preceptors actually are they are our bridge from nursing theory to nursing practice. So what we are doing now is teaching our students SBIRT in the classroom, but that's not enough. It's essential that they learn how to integrate this into the clinical setting, and that's where you as preceptors come in. So I'd like to introduce you to my colleague, Dr. Linda Reed, who is one of our faculty in the School of Nursing, and she will tell you more about why it is so important for you to help us engage our students in translating SBIRT from the classroom to the clinical setting.
My name is Dr. Linda Reed, and I'm the Chair of Advanced Practice Nursing Programs at Azusa Pacific University. My faculty and I, over the last 3 years, have really tried to incorporate behavioral health strategies into primary care practice for adult gerontology and family nurse practitioner students. Learning that alcohol misuse is a primary care problem and not a psychiatric pathology is new to us as providers. We haven't been trained to explore these issues with our patients unless we were concerned about alcoholism. That old adage of don't look for trouble still guides our history taking. What we have learned from SAMHSA over the last 5 years is that chronic daily alcohol misuse can impact our patients, particularly those living and aging with chronic illness. As preceptors, you can really help our students to realize that chronic daily use of alcohol impedes patients' ability to manage their own self-care. Our students are learning and reflecting on screening, motivational interviewing, and longitudinal follow-up for patients with chronic daily use of alcohol throughout their NP program, and will take these skills into their future practice. We're hoping that as preceptors, you'll join us in this effort. We're preparing our students with billing codes, rationale, and guidelines for management. If you haven't done your SBIRT training yet and would like to learn more about how to do the brief interventions or the screening, please take our SBIRT training for free.
Now I'd like to introduce Dr. Sam Gerges from the Department of Graduate Psychology.
The American Psychological Association has recognized SBIRT as a standard of practice for several reasons. First, it is evidence-based, which means there is ample research to support its effectiveness. Second, it is cost-effective, as substance use is costly to communities and to individuals. Third, it is brief, taking at most 5 to 15 minutes in clinical and community settings. Lastly, SBIRT practice is valuable in that it helps us identify substance use in our community and clinical settings.
How can you join us in our Student SBIRT initiative? First, you can get trained on SBIRT yourself by taking the online interactive SBIRT training that we developed under the SAMHSA training project. To access the training, visit our website. Our website is www.sbirtfaithandspirituality.org. Let me repeat that. www.sbirtfaithandspirituality.org, and register as a user. Once you get to the site, you will be able to interact in the 6-module training. The online training includes modules that will introduce the epidemiology and science of substance use disorders. It will highlight the importance of SBIRT in healthcare, clinical, and community-based settings. It will review the screening tools used to screen for substance use. It will also instruct on the steps on how to complete a brief intervention using motivational interviewing, as well as how to make a referral to treatment for further assessment. After taking the training, take some time to explore the website and download the resources that we have available to you. There's a variety of resources on our website that will help you and your students be able to conduct SBIRT. There's screening tools that will allow them to screen for alcohol and drug use within your setting. These tools are validated and have been recognized by SAMHSA to be used with SBIRT. You will be able to download how to conduct a brief intervention, including multiple motivational interviewing resources. You will also find a variety of resources and handouts on drug education and how to learn about the variety of different alcohol and drugs that individuals take. You will also be able to download an observational checklist where you can supervise students on the practice of SBIRT to ensure fidelity, that they are implementing SBIRT as intended. We look forward to partnering with you in our Student SBIRT Training Initiative. We are confident that your participation in this initiative will help better prepare our students to be better practitioners and clinicians and professionals in clinical and community settings. Thank you.